Everyone, welcome to my channel. Today I'm going to discuss the resources which I have used for my own exam, medical qualifying exam part 1. So I'm going to discuss all the resources which I have used for my own exam preparation, and they were very helpful to understand the Canadian healthcare system as well as how to tackle the questions in terms of Canadian resources. There are multiple links which I have sent uploaded in this document. These are all the resources would just not help me to understand, but as well as it really helped me to tackle and tailor some of the questions in my own exam. So I would highly suggest that if anyone wants to take any link from this one, I will be putting in the description, or you can put in a comment box and I can reply on that basis. But I just want to make sure before we move on, these resources are all on the exam pattern of 2024. If we talk about 2025, there might be a slightly changes, because many of you have heard that now they are changing the exam pattern. They are removing the CDM cases. They are trying to give you some more time on the questions with respect to the exam of this year. So there might be a slightly changes, but as far as the website is saying, it seems like they are not changing many of the stuff, but there will be expected changes which is going to be applied from April 2025. So if you are giving your exam for 2024, you can take the highlighted points, whatever feels good to you from this document. But if you are giving an exam in 2025, maybe this might be not the 100% applicable to your exam. So before I start my description about the document, I'm just going to say that all of the resources are solely my own experience as an IMG giving an exam of QE1. There is no authorization with MCCQE or any other organizations. Okay, so let's start. Number one thing which I want to mention is the exam pattern is going to be applicable from 2025. This is the link which I have opened it here, and the only change, which is the biggest change, is CDM component is being removed from the whole exam. Instead of giving 210 MCQs questions, they are giving you 230 questions. So if I calculate my exam pattern, we had a 210 questions and we had 4 hours to complete. That means 240 minutes for 210 questions. One question is usually should be attempted in 1 minute and 8 seconds. But if we talk about this new exam pattern, there might be a slightly little increase in the time when you are spending on each question. So if you talk about 230 multiple questions, then they will be giving you 6 hours and 30 minutes. So that means you can divide it 3 hours and 15 minutes in first section, which is going to be that there will be 160 minutes for 115 questions, and they are going to give you the second portion in which they are going to give the 160 minutes with the 110 questions. So basically they are just trying to give you some of the more time, but that is very less. So the changes that they are allowing the candidate to spend more time on each questions. What these changes are going to do, they are giving you a little bit more time to spend more time on each questions. If I want to calculate the timing, so we can calculate in this way, that let's take, we have a 230 questions, and if they divide into 2, that's what they have mentioned here, that the new exam consists of 230 MCQs. A portion will be pilot questions, but we never know what the pilot questions, which are the pilot questions. So we always attempt at the best of our ability. The MCQs will be presented in 2 sections in 160 minutes each, but they haven't mentioned how many questions will be given in each section. So we have no clue at this point of time. But if I divide in a simplest half of the form, then you might have 115 questions in each second. That will be around 160 minutes. So it could be possibility that you might have to spend 100 and maybe something like this on your 115 questions. So it will take you, so basically you are spending more than that, not 1 minute and 20 seconds. So there might be a changes, but we don't know yet how many questions in each section. But yes, the one thing which they have also mentioned, the change will also allow candidate to spend more time on each questions. The integrity, validity, and reliability of the MCQ Part 1 remains the same, with the MCQs continue to assess the critical knowledge and the clinical decision making. So their motive to assess the exam is the same, but the pattern might be changed, and this is going to be starting from April 2025. So whoever is giving the exam in this duration, my resources might not be very helpful, but at some point of time, all the things which are mentioned in the MCC objectives, if they stays, then definitely these resources and links can be helpful for the exam point of view. Okay, so before go with anything else, I just want to mention, if you have any questions, any confusion, you can put your comment down below, and I'll try my best to help you as soon as possible. Thank you. Let's get started with the main resources sections. Just an overview what my experience is. If you are not doing a job, the exam takes you around 6 to 8 months, but if you're doing a job, it might give you a 12-month period in which you can prepare and be fully prepared for the exam. This definitely doesn't include that 1 or 2 hours of study each day from the day one. If you're starting to study for 5 to 6 hours, then it would be the great one, and at the end, at least you are studying for at least 2 months for 10 hours, and the nearer you are with the exam, the more you have to study and spend time on the revision basis. Okay, so number one most important thing is, which I have imagined, or I can say assuredly, that MCC practice tests are very important. If you have the access of MCC practice tests, don't just solve the MCC objective test. Try to abstract the topic of that each question, and use that topic as your own topic of the day. So that means, let's suppose if you have done 20 questions of MCC practice test today, and you find there are 3 questions from psychiatry, 3 questions from obs, 2 questions from gynae, here and there are other 10 questions, and if you want to choose something what you're going to study, so you need to make sure that you are making your strong grip on those topics which from where the top questions are coming. If there's a generalized anxiety disorder, you have to make sure you understand very well about the disease as well as the management plan. If you talk about fibroid, if you talk about endometriosis, anything which came into the question, you should make sure that you are reading that topic very well, because that topic is one of the highlighted topic and important point of view from the exam point of view. So that means you have to study the whole topic from A to Z, and try to read in every aspect to make sure that you have a very good grip on that. So that's why MCC practice test is not just solving it, but making sure your grip on those topics is very good. And second most important thing, if you can remember the answers, I would highly suggest that it will help you to distinguish where were you remembering and if they ask something opposite, if they ask something similar, you will be having an idea where to put your answer narrowing down. Second most important thing, MCC objectives. As everyone know, MCC objectives is the most important key blueprint of the QE1 exam. If I go on this link, if you don't know how to get it, just go on the MCC website, go on the examination, and if you will find examination objectives, and if you go on examination objectives, the most important thing is the medical expert, because medical expert is about the knowledge and everything. Once you come down, I know it looks so much lengthy, and if you click each and every topic, there might be multiple topics on which you might have to study, you might have to say high yield topics, but the one thing which I find very easy is this one. This toolbar is very easy to search for your own topic. Let's say, suppose you are doing pediatrics today, you want to see, oh, pediatric is full of everywhere in Toronto notes, you don't know where to start, where to end. I understand that feeling, because once you start something, it's very difficult that you make sure that you read it and you remember it. So if you are starting something, you want to compare the Toronto notes, okay, where I am, where I have to fill it, so you just write it something here. Okay, if you are on the hypertension, let's take that one. If you are on the hypertension, you just write the hypertension word here and see what's coming on the this bar. So you see the topic is coming as a hypertension in childhood. That means your hypertension doesn't come only with the adults, but you have to do it with the hypertension in childhood too. And then once you open this part, There are multiple things which are coming with the hypertension, but if you open this topic, then you will find out what are the causative conditions. So casual conditions, or the causes of that particular symptom or sign, then you have to look for and read according to these ones, and then you can move on. So I think the way this search bar is going to give a very good help when you don't find the stuff here and there, because neither these are symptom based, neither these are chapter wise, they are alphabetic wise, and it's sometimes it's very difficult to find something you are not sure. So I think writing just the keyword is going to help you a lot on this MCC objectives website. Okay, now after that, Toronto notes. Everybody heard of it, Toronto notes. Some people find it to be very digestible and easy to read, easy to track. Some people don't find it. But my own experience not working with Toronto notes and working with Toronto notes. Let's take two people. One person who from the day one they start reading Toronto notes and they are good to go with the Toronto notes. They don't feel any difficulty in remembering things or understanding things. You are a good person to fit in the Toronto notes. That's the best. And what you can do is you can read 3 to 4 readings before you go for the exam, because Toronto notes is a huge. There are lots of material. You have to remember most of the things of the Toronto notes. So what you have to do is you might have to understand at the one reading, you might have to familiarize yourself with the first reading, and then start remembering the most important things each and every reading. As far as I have experience, I believe 3 to 4 minimum readings should be given if you are a person of Toronto notes only. Second person like me, who never understand the Toronto notes at the first place, they was like, we cannot digest this book because of having a different way of writing, because having a huge material, because having a lot of things going around. Then you can try to use any resource which you like, because as far as your concepts are clear, you are selecting the investigations and management plan according to Canadian guidelines in each and every conditions, you are good to go. There is no hard and fast rule that you have to use this book, you have to use that book, as far as your concepts are clear. But as I was preparing, I did not find Toronto notes as an easy for me at the first place. So I started reading from all over the places, and it took me a long while to grab and get the grip on all the topics. But once I was very much familiar with those, when I read the Toronto notes, I really like it, because they give me a concise way of everything. I don't have to look for 3 other books, reading for 2 other links, and making sure that I'm having a good grip on it. And if you have an up-to-date is a very good resource and very authentic resource. So in that situation, if you don't want to spend a lot of time on up-to-date, you can only use the summary and objectives of every topic, whatever topics you want to search, as well as you can use the flowcharts to remember things. But if you are not a person of a Toronto notes, I would highly suggest at least one reading before you go for the exam is a good enough, because most of the things which you will realize, oh, I remember this now, it's easy to do. That's what I felt. So I think it's not bad to try. But psychiatry is the most important topic, and gynae and obs, which I believe Toronto notes has given very precisely, very beautifully. If you can remember those, that would be great. But it's really everyone's own capacity. So if you are not Toronto notes person, but you really feel you want to make a grip, just read the topics from the authentic resources, in which you have to make sure you are clearing your concept and remembering the important things. There are multiple things. One is up to date. You can use some U-word, you can use some MTB, you might be able to using some notes from some of the teachers which they are teaching QE1 preparation. So it's really up to you. But I think the last point which I can mention is, if you are reading a topic which is an MCC objectives, your topic should be strong enough. That's it. Okay, third portion is the screening guidelines. As everyone knows, screening guidelines is the heart of the exam. It always comes, it never excluded, because screening guideline is being practiced on everyday basis by a family physician in Canada. So if you say yourself, oh, I don't know what the clinical guidelines of this and that is, if you go on this simple Canadian Task Force on Preventive Healthcare, there is an American states also. So you have to just write it down, Canadian Task Force, and you will figure out this website. Once you come on this website, you have to navigate it very easily. There is no hustle. Let's take there. If you see here, there are lots of things available, but I don't want to spend much time on this, so I just go on this one, guidelines and the published guidelines. Published means which are the most recent, and you will come up with the all the guidelines along with the years. So as we all know, there are many guidelines you can see on the screen, but the most important and the importantly from exam point of view is number one, abdominal aortic aneurysm. It's, you have to remember the age, you have to remember the investigation. That's the most important thing. So if you come here, you will find the two recommendations here, and this is the what you have to remember. Now they will not give you a case of 75 years old patient coming with this and what you gonna do. No, they will give you a full scenario of a patient is having this, what else you want to do. Let's suppose second thing is patient is coming to be concerned about something, that his colleague, his family member had some kind of cancer, should they go for screening. Then you have to remember the age. So there, where the age comes and where the gender comes, it depends on the questions. But there is a question which they are looking to give you an screening, but they want to give you an extra information to make sure you are making your preventive medicine practice ongoing with that patient. So I'm not going to open everything, but the most important thing is abdominal aortic aneurysm is important, and breast cancer is important. It is the new guidelines which you can look after this one is very important. This one is very important. If you talk about colorectal cancer, I would highly suggest to go on the Toronto notes of colorectal flowchart. That's the best scenario where you can find a lot of questions. You just have to mix up and match your questions and your ages and the first family member, second degree family member, how many peoples are there and something like that. So just mix and match and remember that, because they don't give you a patient, they might give you a history of family positive history, and then you have to look if the patient is applicable for the screening or no. Depression, there is nothing much, but I think it would be a great idea to just do it once or twice before you go. And diabetes, yes, but you can read it from the Canadian diabetes guideline. That's also one thing. And apart from this, you have to do the lung cancer screening. You don't have to do anything about prostate cancer because there is nothing like that. So all of these are very important, but I believe if you use this website, you will be 100% sure that whatever you are reading is coming in your exam, and you will be making it correctly as it is. Okay, let's talk about public health. Public health, it's all depends upon the exam. Someone who is sitting beside you giving the same exam, they might have no questions of public health, but it doesn't mean you don't have. You might get a questions of public health. Public health is somewhat very good written in Toronto notes, but there are some things which in the MCC practice test which I haven't seen in the Toronto notes. So I believe that this website which I'm going to open in a minute, is very helpful, and this is the website which is also mentioned as an authentic resource for the Canadian exam. So I just write it down. If you can do it from Toronto notes, that's absolutely good, but if you want to do something a little bit more on it, so you just have to write phprimerafmc.ca when you will come here at the book. There are many things here. If you see, there are 14 chapters. All the chapters according to the MCC objectives, they are important to remember and study, but definitely it's going to be very vast. So what I used to do when I was doing it, I have read this website like once or twice, not 100%, but yeah, I did. So it really helps me to understand many of the things, and I got a lot of questions which I feel that this website really helped me to tackle those questions. So if I talk about this one, if you go on here, you might have to see, okay, do you feel that these are the things are coming in MCC objective? Is yes, then go ahead. If don't, then you can switch to the another portion. And here, if you see yourself, then you will see determining of health status might be important topic. If I go to the cultural competencies, there are some indigenous community determinants of health. It is good to study because of if you don't have much information or much knowledge about indigenous community, that might be a little helpful, because indigenous community is a topic which is which might be here. I'm just going to see aboriginal, or it's an indigenous community. topic in MCC objectives. Okay, so there is an indigenous health topic here. So that's what I'm saying, like indigenous community questions or health questions can come up in the exam because they have given us an objective. So it is a good resource for you to see what you can study. This 5 strategy of Ottawa Charter is important. The reason I'm saying it because this is the things which I saw a question in MCC objectives, MCC practice test. My bad. Uh, but this is just the 5 points. If you can do it, that's amazing. So I'm not going to go in step by step, but I feel like when you open this, you might be able to understand what looks familiar to you, what not. And if you have any doubt, you can just go back to the MCC and write it down. So there are many things here, step by step, which you can look and go ahead and read the stuff. You don't have to read everything, but as much as you read, it will be beneficial, I would say. Okay, now I'm going to the ethics. It is a very important topic, very popular in each and every exam. There will be nobody person who will say I never get a question of ethics. Ethics is a very major portion for QE1. Either way, this way or that way, but you have to remember many things according to Canadian ethical uh, perspective. Okay, so I'm going to put the link. I have put the CMPL links. This is the if you want to read from Toronto notes, that's absolutely fine, but I believe some of the things from CMPA website should be done before you go for exam. And that's at some point of time, it's not very boring, but it's interesting to study and see how the healthcare system works here, how they are dealing with the stuff. So if I am going to open these, I'm just going to tell what are the things I have studied for my own exam preparation. This is the medical legal handbook of the physician. How you will get to this? If you go on the advice and publication, you will get it on the handbooks, and when you come on the handbooks, then you will find out this medical legal. This is whole is important. I know it's scary. Other than you don't have to remember the timelines, they like these timelines and limitations, but if you can do it, you will just have to understand things. There is nothing to remember, but everything is important in terms of if you talk about all of these stuff. There is one more thing which I believe we should talk about is this one. If you go on handbooks, the number one which I said to you is the medical legal cases, and number two, it is the consent. As we all know, consent is very important, so you can do the consent also. Second link which I'm going to start is the e-learning. Everybody knows about e-learning, most of you. If you can do all of these e-learnings, it's very beneficial. It gives you a little bit activity, and it's around 20 to 15 minutes, not more than that, each and every e-learning. As much as you can do, it will be very good for your preparation. Number third, good practice. Good practice is very important. The reason I'm saying is I have seen, I have studied, I have experienced a lot of questions which you can remember once you know what the basics of the good practice is. If you go on each of this, you will find a couple of topics which are here and there. You have to read all of them. I would highly suggest as much as you can. E-learning, you can get it from here, and good practice, you can get it from here. If you cannot navigate it, just write here good practice, you will find it. Okay, so the fourth one, which is kind of a very good, the one thing which I have been doing when I was using this website is anything which has come up in my mind. Let's take, I find out that I don't understand, what do? Do we report to the police? Do we don't report to the police? Do we have to involve family or no? Then there are something like, once you write it here, police or something, or maybe a 2-3 keywords, you will figure out how many kinds of resources are available on the website, which is might difficult to navigate. So I think hit the brake. Do you need to report the patient to the fitness to drive? This is a very important thing, we know, but we have to see where we can say We don't have to report everybody. Let's suppose if you see a patient that okay, you are not fit to drive, don't drive, and they're not driving, that's good, but you have to report. But if a patient who says no, I can drive, I'm okay, I'm fine, but you have to report, but you have to make sure you patient understand the consequences of doing the driving and everything. So that's the one thing which you can see from here. And I believe I was very confident when I used to search on this bar and I figure out what the answer is. And most of the times all the information which I'm getting from here, answers are very pretty good in the different Q banks which I have done. Okay, any type of coaching sessions definitely will help you to navigate and understand the Canadian exam environment. But just remember one thing, doing your self study is the key, because you know your weak points the most. Your tutor, your mentor will not be able to point out all of your weak points, but you know where are the things which you have to remember. So as we all know, psychiatry is very important. So if you're not good in psychiatry, make sure you do your best for psychiatry before you go to the exam. So I believe these are all the multiple things which is very important when we are going for the exam and we are confident enough to attempt the exam and sit in the exam. Okay, if you have the access of MCC practice test, make a list of the topics from where the questions are given and read and remember every detail of those topics. I have mentioned earlier in this video that how you can get the name of the topics from each and every questions. Okay, let's break down the higher topic. There are multiple things. There's a huge amount of topics on the MCC objectives. Let's discuss the first one, psychiatry. As I was coming from a country where psychiatry is not highly studied during the med school, so I used to feel like psychiatry is one of the things which is very weak or very unfamiliar to me. I did a 3 to 4 times read from Toronto notes because I don't feel anywhere else in the resources point of view other than Toronto notes psychiatry is good enough. So I think just read the Toronto notes for psychiatry. You don't like it Toronto notes, that's fine. You like its Toronto notes, that's best. But psychiatry is very important from Toronto notes. Best resources you can follow and revise as much as you can. Side effects of antipsychotic and antidepressants are very important. That's a big tip. You just don't have to remember the DSM-5 criteria for each and every condition, but you have to remember the medication. But at the same point of time, side effects are very important. Obstetric and gynae, second most important thing. Everything is important here. Whatsoever you do, labor, antepartum, postpartum, endometriosis, fibroid, ovarian cancer, cervical cancer, everything, screening, everything comes in this category. And I will also include the breast topics. Breast, not just the cancerous but the non-cancerous conditions are very important in the obs and gynae. Third topic is peds. It's a very important topic, very huge topic, very big chapter in Toronto notes. Definitely seeing the peds and as well as seeing the whole adult in the different place is very challenging. But I have summarized few of the things. It's not once and for all. You have some other things, but these are all the important questions or important topics which you can basically remember things most importantly. And as I mentioned, MCC objective is the best resource to make sure you're not missing any of the topics. So I think for peds you can follow it very closely. Congenital heart conditions, if you want to use something to remember the conditions, cyanotic, acyanotic and everything, you can use the step 2 first aid book, and that will be very good. If you want to use the Toronto notes, that's also absolutely fine. Skin rashes, what I mean by that is all the infectious conditions coming on the skin, measles, mumps, rubella and infectious mononucleosis, anything you talk about, just see the picture on Google's, because picture do give you an idea how the rash look like as well as where it is presenting. GI diseases, especially the one which is a neonatal, they are very important. Hypertension in childhood, we just had few minutes back, we have looked into the MCC objectives, so that's the one thing. And you can, when you go on the Toronto Notes Index, there will be a common complaint heading. You have to read the whole block of that common complaints. Neonatology in the Toronto Notes, you have to do the same, because neonatology is very important, especially the resuscitation topic is important, and onwards everything. Respiration diseases, bronchiolitis, croup, um, abscess, epiglottitis, everything. um, maybe infections on the respiratory stuff. Ear and eye infections are important, because upper respiratory infections might give you the ear infections, or any ear infections are coming. And ear infection is very common, especially otitis media. They're very common in kids in Canada. Emergency medicine, yes, you have to do it. It's very important, especially if you talk about the geriatric population. Why? Because if a patient is a geriatric population, they might come with dehydration, they might come with the fracture, they always come into the emergency. So basically geriatric and combined with the emergency is one thing. Rheumatology, two important topic, especially osteoarthritis, septic arthritis, rheumatoid arthritis. And if you talk about fibromyalgia, if you talk about polymyalgia rheumatica, if you talk about CREST syndrome, all of these things are very important. There are multiple things, but I'm just giving an overview. Orthopedic, tendon diseases and motor vehicle accidents are very important. You can read the fractures also, but the most important thing is not just the fractures. You have to remember, read the stuff regarding the tendons, cartilages and other stuff. Geriatric, all time favorite, all time important, because our population, you can see in the Canada, there are number of people who are above the adult, like they are in the geriatric. So there are many conditions which are coming: dementia, delirium, activity of daily living, fractures, osteoporosis, everything is important. GIT, yes, it's important. Respiration is important. Endo is important, and endothyroid diabetes is very important. Nephro, you can talk about other stuff, but along with that, don't miss the electrolytes. This is the very important topic, I would say. If you don't understand electrolytes much, you can use some YouTube videos, you might use some other resources to make sure you understand very well, and you are able to treat the patients with the electrolyte imbalance. Vascular, PAD and edema and everything, yes. Urology, male genital diseases, infertility is very important, not just females but also the males. So this is not something which I would say don't read anything other than that, but these are the things which I have seen, I have experienced, are very important for exam point of view. So I would highly recommend to strong these points before you sit in the exam. Next is few website which might give you a little bit of help when you are looking forward to see what are the other resources which you can use. So up to date, most of you are familiar with the up to date. If you don't have the familiarity, you can just write uptodate.com. It's a subscription based. If you don't have the subscription, and someone else in your friend or maybe someone is having subscription, you might ask them to give you some flowchart screenshots or saving something. But up to date is a very good investment, because this is the authentic one if you talk about from where the questions are coming in an exam point of view. So if something is written in up to date, probably the answer will be the same. Whatsoever in written in other resources, that is not the 100% sometimes, but up to date, whatever it is written, it's absolutely correct in the exam point of view. CPS, Society of Pediatrics. The one thing which I would say, CPS Society is the only thing which I feel like is when you are not pretty much sure where you should go for other stuffs, the only thing you can do is you can use the Canadian Pediatric Society. If I talk about failure to thrive, okay, let's see if I can find something. So there might be a topic of failure to thrive, recognizing and addressing the growth. That's a atypical growth. Let's see. So sometimes it's not everything is possible in this website to navigate and get the answers, but some of the things which you are confused enough to say that okay, I don't know what to do, then you can try to find out some of the things. And I do say that I have seen like these types of things are really helpful to answer me. If you don't want to read anything, don't read it, just go to the end page and read the conclusion. They always have a very good conclusion or very good references where you can see okay what they have summarized it. So that's also one thing. It's not really 100% you will get every topic, but many topics you will figure out from this one, and I believe this is the authentic resource to make sure I am reading the correct one. So I do feel this is a very useful one, but it's really everybody's own choice. One tip which I have felt very helpful is Pete's Cases. This is a website in which the doctors are from the Canadian system, presidents and physicians and everybody are putting their efforts to gather some of the information. The one thing which I feel is very good is this one. This is the one page of everything of a disease. If you talk about hand foot mouth disease, which is important and very prevalent, so you can find everything here, and probably you don't have to go here and there. You will not find all of the topics, but if you want to search something here, you can do that. There are some videos. I have studied one video regarding the rashes in kids, and that was very helpful. If you have time and you want to look for something regarding the peds topic, you can do that. They might have podcast it. If you are a person to listen something, that's also helpful. But I believe the one thing which I feel the notes was very helpful for me, and I was able to see the pictures. I was able to navigate the flow charts and everything, and they were very helpful to remember things. Okay, after that, diabetes. If you are not familiar with this one, this is the only guideline of Canadian diabetes. If you don't want to read everything from this topic, I'm not suggesting you, but if you want to take something, let's take the target one. You just have to write the key message on this one. You don't have to read anything from here, that's huge, but you can write these figures. Remember these figures, or you might have a recommendation or conclusion or something. Just the overview of some of the websites might give you most of the answers. Okay, and one thing which I have done is the quick reference guide. Like I did this before my exam, and it was very good for the quick review. If you have printer at home, just print. There are 7 to 8 pages. You can get it the printable form, and this is very important, very good, and very quick to refer. Okay, Gina, which is very new to me, came across to me. Uh, I cannot download this, but if you can find the Gina asthma on the Google, I'll just do it for you. Gina asthma guidelines, then you will find out. And the only thing which someone told me is you can read 3 pages of this one, but you have to read the Toronto notes and everything for asthma point of view. So that's the one thing. One tip which was very helpful, maybe you guys like it or no, it's optional. Cartoon style pictures. What I mean by that, cartoon style pictures always stick in your mind. I'm going to give you an example what the cartoon style picture is. Normal pressure hydrocephalus. If you're a person who knows what is it, that's absolutely amazing. But if you don't know it, then I'm going to show you what it's look like. If you go on this one and you go on this one, you find this picture. You have to remember 3-4 points from this picture. That is not something you don't know about the topic, but at some point of time you might remember, oh, I saw a picture of urine incontinence, magnetic gate, and the patient was having some kinds of CNS problems. Then what it looks like, it's a normal cephalus hydro, and what you will find here is ventricular enlargement, and the treatment option is going is the shunt from the ventricle to peritoneum. So this is the one thing which I feel. There are multiple cartoonish picture. If you can write medcomic.com at the end of something, then I believe you will find thousands of pictures, and they are very helpful to remember most of the things. Okay, one of the things which I remember from my own questions bank, concussion is very important, very common. So there is a guidelines which you don't have to remember everything, but I have found it very helpful when to return. So if I talk about parachute guidelines, so when you go here, you will find this is the parachute guidelines on Canadian guidelines on concussion. And if you will come here, the most important thing, when you will download it, you will find out when to return. That's the most important things you have to remember. You can remember sign and symptoms, investigations, but the questions always looks for when to return to the sports activity, when to return to the class, when to return to the normal activities. So that's the one thing which you can figure out in this one, and that's something which I have seen. So this was all about today's session. It was pretty long, but I tried my best to keep it as focused as I can, and I try to open all the websites so you can go back and forth through navigate the website. There might be further resources, multiple resources, which you will be um, getting information from different peoples, but the things which I have shown you today is all about me and my own experience with the exam. I feel whatever I had followed or whatever mentioned here in the document was really helpful to attend my exam. So good luck with your exam, and I hope your spend time spent on this video might give you some help. And if you have any questions or you want to comment for anything, I would happy to answer. I will happy to see. Thank you so much for coming to my channel. Have a great day, and I wish you all the very best for your Q1. It's a long process, but trust me, it's a worthwhile process. So just trust with the process and just go for it. Okay, that's all about today's. Thank you.